In our previous video, we reviewed several common foods that can worsen back pain. If you did not see that video, search for foods that make back pain worse to learn what to avoid before applying the changes I discuss here. Hello. If you are looking for a sustainable way to reduce chronic back pain, please consider this. Medicine and physical therapy matter, but the foods you eat every day play a powerful supporting role. Your daily diet influences low-grade inflammation, sleep quality, tissue repair, and body weight, all factors that affect how your back feels. Small, practical changes to what you eat can reduce pain intensity, improve sleep and energy, and help you move more comfortably. Part 1. Why does food affect back pain? Food interacts with the body through several biological pathways. It affects blood sugar control and insulin responses, hormonal balance, oxidative stress, and immune signaling. Some foods promote a persistent low-grade inflammatory state, sometimes called chronic background inflammation, that increases sensitivity in muscles, tendons, and spinal tissues. Other foods supply antioxidants, polyphenols, and omega-3 fatty acids that counteract inflammatory pathways, improve microcirculation, and support tissue repair. In short, food can either increase the burden of inflammation or help reduce it. Your choices determine which way you move. What are the practical benefits of an anti-inflammatory eating pattern for older adults with back pain? Lower frequency and intensity of chronic pain episodes. Better sleep quality, which enhances tissue recovery and reduces pain sensitivity. Improved weight control, which lessens mechanical load on the spine. More consistent daily energy and better tolerance for light physical activity. Simple guiding principles you can use today. Favor whole, minimally processed foods, vegetables, fruits, fatty fish, legumes, nuts, seeds, and whole grains. Reduce ultra-processed foods and refined sugars that promote inflammation and destabilize blood sugar. Include omega-3 sources several times per week. Fatty fish such as salmon, mackerel, or sardines, or plant sources such as chia and walnuts. Cook with extra virgin olive oil instead of highly processed seed oils or trans-rich fats. Add more dark leafy greens and berries for antioxidant and polyphenol support. Use anti-inflammatory spices like turmeric and ginger in everyday cooking. Make changes gradually. Adopt one new habit at a time so the change is sustainable. Realistic daily examples you can implement. Breakfast, oatmeal topped with berries and a spoonful of chia seeds, steady energy, fiber, and antioxidants. Lunch, a large salad of mixed greens with grilled or canned salmon, a handful of walnuts, and a drizzle of extra virgin olive oil. Dinner, lentil stew or baked fish served with steamed vegetables and a modest portion of quinoa or sweet potato. Snacks, fresh fruit, plain yogurt, or a small handful of mixed nuts. Safety and individual considerations. If you have chronic conditions, especially heart disease, kidney disease, or if you take medications such as anticoagulants, discuss major dietary changes and supplements with your physician. Certain concentrated supplements or high doses, for example large doses of curcumin or omega-3 capsules, can interact with medications. For older adults who have difficulty chewing or digesting, adapt textures and preparation methods. Cook foods until soft, chop or mash as needed, or blend into smoothies while preserving whole food ingredients. How to measure whether changes are working. Keep a short daily log for 2 weeks. Each morning record a single pain score from 0 to 10, note sleep quality, and rate your energy level. Look for trends rather than day-to-day noise. If improvements in sleep or pain appear after a week or 2 of consistent changes, that is an encouraging sign to continue and expand the approach. Summary. An anti-inflammatory eating pattern is not a miracle cure, but it is a practical, evidence-based tool that supports reduction of back pain when combined with other therapies. Prioritize whole foods, include fatty fish and plant sources of omega-3, increase leafy greens and berries, cook with olive oil and use turmeric and ginger as regular seasonings. Start with one manageable change at a time and track progress. If this version of Part 1 is approved, I will produce Part 2 with specific prioritized foods, brief explanations of the biological benefits for each, simple 10 to 15-minute recipes, and preparation tips tailored for older adults. Part 2. Priority anti-inflammatory foods, biological benefits, and quick recipes. In this section, I list priority foods to add to the daily menu. For each group, I explain briefly why it benefits people with back pain, then provide a very simple 10 to 15-minute recipe and practical preparation tips suitable for older adults. Fatty fish, salmon, mackerel, sardines. Why? Fatty fish provide omega-3 fatty acids, EPA and DHA, which regulate inflammatory pathways, reduce production of pro-inflammatory cytokines, and support microcirculation that nourishes tissues. For older adults, eating fatty fish several times per week can reduce chronic low-grade inflammation and support pain management. Quick recipe: lemon herb salmon, 12 to 15 minutes. Season a salmon fillet with 1 tablespoon of extra virgin olive oil, the juice of half a lemon, a pinch of low-salt seasoning, and a sprinkle of dill or parsley. Roast or pan-sear for about 5 to 7 minutes per side until just cooked through. Serve with a simple green salad. Tips for older adults. If chewing is difficult, flake cooked salmon and mix with mashed potato or soft grains. High-quality canned sardines drained and mixed with a little mashed avocado are a convenient alternative. Dark leafy greens, spinach, kale, Swiss chard. Why? Dark leafy greens are rich in vitamins, minerals, and polyphenols that act as antioxidants, lowering oxidative stress in muscles and connective tissue. They also provide vitamin K, which supports bone health. Quick recipe: garlic sautéed spinach, 6 to 8 minutes. Rinse leaves, heat a tablespoon of olive oil in a pan, add minced garlic and then the spinach. Sauté briefly until wilted, season lightly. Serve alongside grains or protein. Tips for older adults: cook until soft, chop finely before serving, or blend into smoothies with berries for an easier texture. Berries, blueberries, raspberries. Why? Berries contain anthocyanins and polyphenols, potent antioxidants that reduce inflammatory markers and support vascular health. Quick recipe: berry oat bowl, 5 to 8 minutes. Cook rolled oats, top with half a cup fresh or thawed berries and a spoonful of chia seeds. Optionally add plain yogurt. Tips for older adults: choose softer berries or lightly cook steam if texture is an issue. Mash gently if needed. Nuts and seeds: walnuts, almonds, chia. Why? Nuts and seeds supply unsaturated fats, fiber, magnesium, and polyphenols. Walnuts are a good plant source of ALA, plant omega-3. Chia seeds provide omega-3 insoluble fiber that helps stabilize blood sugar. Quick recipe: walnut salad sprinkle. Lightly toast a small handful of walnuts and sprinkle over salad or oatmeal, or make a yogurt parfait with yogurt, berries, and chia seeds. Tips for older adults: soak or chop nuts to soften them if chewing is difficult, or grind into a fine meal to sprinkle on food. Extra virgin olive oil. Why? Extra virgin olive oil is rich in monounsaturated fats and polyphenols with anti-inflammatory properties. Replacing processed seed oils with olive oil can improve lipid profiles and reduce inflammatory signals. Quick recipe: simple olive oil lemon dressing. Whisk extra virgin olive oil with lemon juice, a little pepper, and a grainy mustard. Drizzle over salads or steamed vegetables. Tips for older adults. Use as a flavorful low-salt alternative to heavy sauces. Store olive oil in a cool, dark place. Turmeric, curcumin, and ginger. Why? Turmeric contains curcumin and ginger contains gingerol, compounds with documented anti-inflammatory effects. They can be used as culinary spices or, when appropriate, as supplements under medical advice. Quick recipe: turmeric ginger tea. Slice fresh ginger. Add half a teaspoon ground turmeric. Steep in hot water and sweeten lightly with honey if desired. Tips for older adults. Incorporate small amounts of turmeric and ginger into soups, porridges, or marinades. People taking anticoagulant medications should consult their clinician before using concentrated supplements. Legumes, lentils, chickpeas, beans. Why? Legumes provide plant protein, fiber, and micronutrients that stabilize blood sugar and support a healthy gut microbiome, factors linked to lower systemic inflammation. Quick recipe: chickpea salad, 10 to 12 minutes using canned chickpeas. Rinse and drain canned chickpeas. Mix with chopped tomato, chopped herbs, a splash of olive oil and lemon juice. Serve with soft bread or mashed vegetables. Tips for older adults. If using dried legumes, cook until very tender. Canned legumes are a convenient low-effort option. Rinse well to reduce sodium. Whole grains and fiber-rich tubers, oats, quinoa, sweet potato. Why? Whole grains and starchy vegetables provide complex carbohydrates and fiber that stabilize blood sugar, support the microbiome, and reduce pro-inflammatory dietary patterns. Quick recipe: quinoa bowl, 12 to 15 minutes. Cook quinoa, toss with steamed vegetables, a drizzle of olive oil, and a sprinkle of toasted nuts. Add a small portion of cooked fish or legumes for protein. Tips for older adults. Cook grains and tubers until soft for easier chewing and digestion. Mash sweet potato if preferred. Practical meal organization and preparation for older adults. Batch cooking. Prepare 2 to 3 portions of fish or legumes and steamed vegetables in advance. And store in individual containers. Assemble meals quickly during the day. Cut foods into small pieces or puree as needed. Use herbs, lemon, and spices instead of extra salt to enhance flavor while reducing sodium. Safety considerations. People with chronic medical conditions or those taking medications, particularly anticoagulants, should consult their physician before starting high-dose supplements such as concentrated omega-3 or curcumin. Monitor for any adverse effects after dietary changes. For patients with impaired kidney function, potassium intake from certain fruits and vegetables may need to be adjusted under medical guidance. Closing of Part 2, the foods above are priority choices for building an anti-inflammatory plate that is easy to prepare and suitable for older adults. Each sample recipe can be made in about 10 to 15 minutes, or adapted to softer textures as needed. Part 3 will provide a specific 7-day starter plan, a shopping list, and a 1-page checklist to help begin these changes step by step. Part 3 presents concrete action steps so you can reduce inflammatory load through diet and support long-term back pain improvement. The content includes a list of priority foods, specific meal suggestions, a step-by-step 7-day starter plan, behavior strategies to maintain change, ways to track progress, and medical cautions. 1. Anti-inflammatory food groups to prioritize. The following foods have scientific support for anti-inflammatory effects or for improving metabolic health and are appropriate to include in weekly menus. Fatty fish rich in omega-3s, salmon, mackerel, sardines. Omega-3s, EPA/DHA, show clear anti-inflammatory effects in many studies. Nuts and seeds, walnuts, almonds, chia seeds, flaxseed, provide ALA omega-3, fiber, and minerals. Extra virgin olive oil contains antioxidant polyphenols, suitable for low to medium heat cooking. Dark leafy greens, spinach, kale, rocket, rich in vitamins, minerals, and anti-inflammatory polyphenols. Berries, blueberries, raspberries, strawberries, sources of anthocyanins and antioxidants. Anti-inflammatory spices, turmeric, curcumin, ginger, garlic, and modest amounts of chili, capsaicin. Easy to add to daily cooking. Legumes, lentils, black beans, chickpeas, provide plant protein, fiber, and polyphenols. Fruits high in vitamin C and polyphenols. Oranges, grapefruit, apples, support reduced oxidative stress. Fermented foods, plain yogurt, kimchi, sauerkraut, if appropriate, beneficial for gut microbiota and indirectly affect inflammatory responses. 2. Practical sample meals, easy to implement for one day. This sample is flexible to taste and conditions, suitable for older adults, and prioritizes easy chewing and digestion. Breakfast. Cooked oats with milk or almond milk. Add berries, blueberries, 1 tablespoon chia seeds, and a small amount of chopped almonds. Mid-morning, if needed, 1 apple or 1 small cup of plain yogurt. Lunch. Large leafy salad plus grilled salmon or quality canned salmon plus 1/4 avocado plus sprinkle of walnuts plus olive oil and lemon dressing. Afternoon snack. A handful of almonds or some berries. Dinner. White fish or a lentil stew plus steamed vegetables, broccoli, carrots, plus a small portion of quinoa or sweet potato. Before bed, if needed, 1 cup of non-caffeinated herbal tea. Swap proteins as preferred, skinless chicken, fish, legumes, to fit eating habits. 3. 7-day stepwise starter plan. Goal, 1 small sustainable change per day. The aim is to implement 1 specific change each day to build habits without overwhelming yourself. Day 1. Stop sugary drinks. Switch to water or herbal tea. Add a lemon slice if desired. Day 2. Have oats for breakfast with seeds, berries instead of a pastry. Day 3. Choose fish or a legume dish for lunch instead of processed meat. Day 4. Use olive oil instead of repeatedly used frying oil or butter in daily cooking. Day 5. Add 1 cup of leafy greens to every meal, e.g., salad at lunch, steamed greens at dinner. Day 6. Reduce salt. Season with herbs and lemon instead. Use 50 to 70% of usual salt when cooking. Day 7. Batch cook 2 ready meals for the coming week, e.g., grilled fish plus quinoa, lentil stew. Note: if barriers exist, e.g., difficulty shopping, reorder steps to fit your situation. 4. Behavior strategies to sustain change. Diet change is a behavioral challenge. Practical strategies suitable for older adults. Small measurable goals, for example, no soda today rather than eat healthier. Action chaining. Link the new behavior to an existing habit, e.g., after brushing teeth in the morning, fill a water bottle to take with you. Prep in advance. Shop with a list. Pre-chop vegetables and pre-cook proteins to reduce resistance at mealtime. Short journaling. Each day write 1 line. Today I swapped X, pain before after, 1 to 10. This helps detect trends. Social support. If you live with others, share goals so you get help. If alone, consider joining a community or healthy eating group. Appropriate rewards. After 7 days of adherence, reward yourself with a favored non-food treat. Watch a movie, buy flowers. 5. How to track effectiveness. Simple and practical. To know whether changes are working, track outcomes with a low-burden method. 1-line daily chart. Each morning rate overall/back pain on a 0 to 10 scale. Rate again at night. Compare weekly averages. Note confounders. Sleep quality, physical activity, new medications. Expected timeline. Do not expect instant results in 1 to 2 days. Observe changes over 2 to 4 weeks. If improvement occurs, continue. If not, consider adjusting or consulting a professional. 6. Notes on dosages, allergies, and drug interactions. Dosage. There is no one-size-fits-all dosage. For example, eating fatty fish 2 to 3 times per week is a reasonable target, nuts several times a week, plenty of vegetables daily. Allergies/intolerances. If allergic to fish or nuts, substitute with other omega-3 sources, chia, flaxseed, or consult a physician about supplementation. Drug interactions. If taking anticoagulants, e.g. warfarin, note that high vitamin K foods, green leafy vegetables, or large omega-3 supplements may require discussion with your clinician. If you have kidney disease, be cautious about potassium/phosphorus in certain fruits/vegetables. Consult a specialist. 7. Additional recovery supports beyond nutrition. Nutrition is one component. Combining these practices optimizes results. Gentle physical activity. Short walks, light glute core strengthening exercises as tolerated support spinal structures. Adequate restorative sleep. Optimize sleep conditions and avoid heavy meals before bedtime. Stress management. Light meditation or deep breathing can lower inflammation through neuroimmune pathways. Consult professionals. For personalized programs, see a dietitian or a physical therapist. Thank you for watching to the end of the video. In summary, the food groups just listed: refined sugar, refined carbohydrates, trans fats and fried foods, processed meats, ultra-processed foods, alcohol, high-sodium foods, energy drinks, and foods that cause individual reactions, can all contribute to worsening back pain through various mechanisms. If you are experiencing severe symptoms, numbness or weakness in the legs, or loss of bladder-bowel control, seek medical help immediately. If you want to learn how to replace these foods with safer choices and a step-by-step plan, watch the next video where we will lay out specific solutions.